Hello, good day, sir. I'm Dr. Alia. How may I help you today?
Hello, my name is Mikhail. I'm 16 years old.
What are your complaints, sir?
A week ago, I hit my toes and there was an injury with bleeding, and I tried to treat by myself, but until now it's not healed yet.
Do you feel any pain around your toes? Any walking difficulty?
I don't feel pain around my toes, and yes, I have difficulty in walking.
Do you have any fever or chills? Do you feel any general weakness?
Yes, I have fever 5 days ago, and since then my wound size increased, and yes, I feel weak.
Okay, so I'm going to ask you some questions about your past medical history. Do you have gastric ulcer or any allergies?
No.
Have you had blood transfusion before?
No.
Do you smoke or do you ever had any alcohol or drug abuse?
Yes, I smoke, but I never have alcohol and drug abuse.
Any of your family members have diabetes mellitus?
Yes.
Do you have diabetes mellitus?
Yes, for 34 years already.
Have you ever had any operations before?
Yes, I had operation for appendix 10 years ago.
Do you have tuberculosis or any myocardial infarction?
No, I don't.
Do you have arterial hypertension and bronchial asthma?
No, I don't.
Do you take any long-term medications?
Yes, I am taking insulin for my diabetes.
Okay, right now I want to check your condition generally. Okay, so can you please take off your mask? Okay. Can you please open your mouth? The patient's condition is okay. His glaucoma scale is 15. He is obese and he is not dehydrated. And he also have fever. His temperature is 38.
During the local extremity examination, we can see that the localization of the injury is at the left foot. We can see redness or hyperemia at the dorsal part and cyanosis on the fifth toe. The pulse is present and pulse volume is normal. The local temperature of the leg is normal, but there is numbness with low regional sensitivity. There is no paralysis. The capillary refilling time is 1 second and the regional blood pressure is 120/80. There is no muscle wasting, but there is presence of trophic ulcer. In the examination of the ulcer, we can see that it is healing by secondary intention and it is in the inflammatory stage. The size of the ulcer is 1 to 2 centimeters with no discharge, which means that it is a dry wound. The shape is circular with a bluish black color. It has a smell and local heat is present.
Sir, so from our diagnosis, you have an injury in your fifth toe, which is inflammatory and with the presence of infection. So, right now, a surgical treatment with amputation is needed.
Are there any others way than amputation?
No, without surgery, it is doubtful. But with surgery, the chances of success is 99%. Do you agree to do the surgery?
Yes.
Okay, so this is the consent form for you to fill and sign. Okay, so before surgery, we will run some lab tests, which are blood tests to check your neutrophil counts for inflammation. And then we will do urine tests to check your glucose concentration and also glucose test to see if your diabetes is compensated and to see how much your diabetes affect your injury. We will also do the x-ray on your foot to see how your bone is affected, and also ECG test will be done.
Okay, how long will I be here?
You will be here with us for about 2 weeks for general monitoring of the injury.
Okay, so what is the procedure going to be like in general?
We will be amputating your fifth toe. This surgery is about 30 minutes to 1 hour, and you will be put under general anesthesia at your spine.
In complete blood count tests, we would expect high white blood cell count, high band forms, and high erythrocyte sedimentation rate due to the presence of inflammation.
Okay, so what happened after the surgery?
Okay, after the surgery, your legs will have to be elevated. You should not do any physical activities like swimming, and at least until your wound is healed. And then you have to be low sugar diet to control your glucose level, so that your diabetes will not be worsened. And then you will also have this lipidemia management to control your cholesterol and body fat. And then you have to stop smoking. You will be given some painkillers and also antiplatelet drugs, which is aspirin, 160 milligram tablet, which you have to take once a day.
Okay, thank you, doctor.
Okay, I hope everything will be fine for you.
The surgery treatment plan would be: first, prepping, draping, and carrying out aseptic technique at the site of surgery. Then, the patient will be administered general anesthesia at the spine. After that, an incision will be made, forming an intentional wound, and wound irrigation will be carried out. Then, we will have to control the bleeding at the site of incision. The wound will then be cleaned and debrided. Lastly, the wound will not be sutured, as we want the wound to heal by secondary intention.